Good afternoon. Welcome, everyone. We're going to get started. I am Kay Reuter-Krohn, and I am a member of the Committee on Financial Matters and Retirement. We're so happy to see you all here today. So our speakers today are employees of the State of Wisconsin Employee Trust Fund, Office of Strategic Health Policy. We have Eileen Mallow, Arlene Larson, and Tara Prey. Eileen was appointed the Director of the Office of Strategic Health Policy, OSHP, in April 2018. She had served as the Deputy Director from October 2015 until her appointment, and prior to that as a Senior Policy Advisor in the office. Before joining ETF, Eileen's career includes experience with the Wisconsin Medicaid program, the Wisconsin Cost Containment Commission, and the Office of the Commissioner of Insurance, as well as with local private health insurance plan. Please welcome Eileen Mallow, and she will introduce her team.
Yep.
Thank you.
Thank you. Yep, I can hear myself. So. Thank you, Kay, and thanks for organizing this. We really like to get out and talk to people. As she said, my name's Eileen Mallow. I'm the Director of the Office of Strategic Health Policy. I am fortunate to have with me Tara Prey, who's our Communications Lead, and Arlene Larson, who's our Manager of Federal Policy and knows all things Medicare. We are really happy to be here, as I said, and I think we'll ask for questions at the end, but certainly, keep them, save them up, and we'll be sure that we catch them all. For anybody who came in and didn't get a sheet about the dental rates and the dental changes, if you want to hold your hand up, we'll make sure you get those now. It's just a one-page sheet, and it has a little green bar across the top. So we've got a few over here. Good, and we're going to do this, we're going to tag team it, so everybody's going to do a little bits and pieces, and we're going to start with Tara. Oh, and she just wandered off, so So,
I'm back.
Hey, we didn't practice this part of it.
I know, I was just helping hand out.
So, okay, so I'm going to turn it over to Tara.
Okay, so just going to give you a little bit of an introduction of what we plan to cover today. And we based our presentation on, I believe, your feedback from your leaders here who organized this with us. So what we want you to walk away today with an understanding of your health benefit options available through ETF and the group health insurance program. We want you to understand how Medicare affects your benefits, kind of how that coordinates with the options available through ETF, and also just how to get health benefit information and assistance. So we'll show you some resources at the end of our presentation. And so our topics today will cover a 2019 update, so everything that's changing for 2019 with your health benefits, pharmacy benefits, and also we've got some changes with some of the supplemental plans available. We'll be covering just really high-level ALEX, which is a kind of a fun tool that is only available for pre-Medicare retirees, and I understand we've got a mix here of pre-Medicare and also retirees on Medicare. And then we'll do a Medicare overview, Medicare Advantage specifics, so we'll be talking about the new Medicare Advantage program option available, and then more resources. And I just want to point out we have Whitney in the back of the room from United Healthcare, so they are administering the new Medicare Advantage option. And if you didn't stop by and talk with her on your way in, she'll be around at the break and also after the presentation, and you can talk to her about any specific questions that you might have about how the program works or how you find providers or those kinds of things. So we'll be giving you information about the program in general, and then she could help you out with any specifics. And most of you should have gotten, I believe in the mail yesterday-ish, if not, it should be coming, a plan guide from United Healthcare if you are eligible for the program. So that has some good information in it, and if you didn't receive your It's Your Choice decision guide yet, you should be getting it in the mail any day. Those are in the mail stream, but our printing and mailing company, they kind of stagger the groups as they mail them out. So you should be getting it very soon if you don't already have it. Okay, so with that, I'm going to turn it back over to Eileen, who's going to talk through the updates for 2019.
All right, thank you. So I'm here to talk about 2019 updates. For those of you who don't know, we do have a board. There is a retiree representative on the board, and the board does approve all the major program changes that we go through. They meet 4 times a year, and that's part of their responsibility to do that. So some big news for this year, we have a new plan. It's called Robin, and they partner with Health Partners, which is an insurance company out of the Twin Cities. We are very happy to have them because they've worked with us for several years. They provide very good quality care. They're a tier 1 provider in that part of the state. And if you see the little green box up there, they pretty much go all the way west, all the way over to the Twin Cities from that part of the state. They are what we consider to be an important competitor to some of the other health plans up there because we didn't have a lot of competition up there now. So we were really happy to have them join. They were in last week to talk to us about what some of their plans are going forward. But it is called Robin. The major providers that are part of their plan is Aurora in the northeast part of the state, Baycare, Bellin, which is a big hospital in Green Bay, or clinic system, and then Holy Family Memorial, which is in Manitowoc, and Theta Care, which is in the Fox River Valley. Some of the other changes, as Tara said, we're adding a Medicare Advantage option. We had done a survey, and I think these guys are going to talk about it a little bit more. Excuse me. We had done a survey and asked what members wanted, and one of the things they were most interested in was having a lower cost option. There are some really good things about Medicare Advantage. It is still an option for everybody, but we're going to go over that a little bit more. I think the key points are you get uniform benefits, and it's nationwide coverage, and it's pretty easy to access anywhere you might want to go. Some of the other changes, so if you are in our program, you can get what we call supplemental benefits. They're employee pay all, or in your case, you guys would have to pay all of it. We've made some major changes this year. People found our supplemental plan offerings very confusing. We had like 3 dental options and a little bit of this and a little bit of that. So for 2019, Anthem Dental Blue and Epic Benefits Plus and Epic Dental Wisconsin will all be ending and leaving our program as of the end of the year. So Epic Benefits Plus, you can also see also offer vision, AD&D, and hospital indemnity or hospital and surgical coverage. And those they've all pulled out of the plan. They've all withdrawn. So the big thing is if you are in one of those plans, you should have already gotten a notice from the plans that they're ending and that you need to make a change if you want to continue to have supplemental dental coverage, supplemental vision, or supplemental AD&D coverage for next year. You can see the new carriers. Right now, Delta Dental underwrites Uniform Dental, and we've added a couple of supplemental layers that can be purchased at the member option to add onto your dental coverage. And you should be getting materials in. That's what the green sheets also would explain. Zurich is currently the AD&D carrier. They're going to continue to be the AD&D carrier for the next year. And then Vision, VSP has been our carrier for several years, and certainly that would be a good option for people. One of the things they did this year was expand coverage or how much they will pay for progressive lenses, and they also upped the amount that they would pay for frames, eyeglass frames. So the new supplemental dental plans, so you'd have these 2 options. You can see the additional services that they're going to offer. Some better coverage for people, a little bit more transparent, a little bit easier to use. One of the issues we know people had run into when we had multiple carriers in this footprint is they'd start treatment with one dentist who was enrolled with one of the dental plans who may not have been enrolled with the other dental plans as a provider, and people were in a situation where they'd have like part of their treatment covered and part of it not. So having Delta Dental be the single carrier and allowing people to purchase options we think is going to be a little bit more streamlined for our members. And you can see the 2 different options that you can purchase. Then long-term care insurance will not be available next year. The reason for that is the board a couple years ago established criteria for anybody who wanted to be a supplemental carrier, and we did not get a bid from anybody who was willing to meet our terms. For the next year. So we're not going to have a long-term care option. Certainly they can come back in, or anybody who's interested could come in for the next year. It'd be the 2020 plan year. And as I said, VSP will have some additional benefits, coverage of progressive lenses, and an additional $50 towards frames. And so then we'll add some new medical benefits. The big one is telehealth. If you're not near a provider, certainly you would have a little bit more access to use a telehealth system. I think some people do already. Pharmacy is a good one. Some mental health services are a little bit easier to cover. And if you're not sure, you can talk to your health plan about who's in and who's not in for that. And then we would also allow coverage for home sleep studies. It used to be that you had to go to an institutional setting to get that, like a hospital or a clinic, to get that done. For medical benefits, some of the changes we've made. So tooth extractions have now, we've moved coverage of that from the medical portion of your benefits plan to the dental portion of the coverage that we have. So Delta will be the person who would be managing that. Any claims you would have should go to Delta Dental as uniform dental carrier. Transplant coverage language has been updated. We had a pretty extensive list of transplants we would cover or not, and they may or may not be keeping up with current practice. So we just changed the language to allow the health plans to make a medical necessity determination about what was the right transplant procedure for somebody. We've limited prescription foot orthotics, so 1 per year per foot, and some things that are no longer covered, skin tags, which I don't know how many of you know what those are, but there's something that we're not going to cover anymore, and we're probably one of the last plans to eliminate coverage of those. So I think this one applies only to people who are not in Medicare, because this would not be treated the same as if you were in our Medicare plan. But DAW means dispensed as written. And we are increasing the cost sharing. As you know, we've had a push for a number of years to try and encourage members to use generic substitutes where appropriate. It keeps the cost of our plan down. I don't know how much of you follow, but our pharmacy costs year over year from 2018 to 2019 are declining, which is almost unheard of. So we are being really aggressive about continuing to manage pharmacy costs as a way to keep overall premium costs down. And one of the things we're doing is changing the way we cover dispenses written cost sharing on this. So if you have a level 3 drug, which would be Tier 1 or a level 1 drug is a generic. Level 2 is something that's a name brand but is pretty reasonably priced. Level 3 is a little bit higher. So currently you would pay 40% coinsurance up to $150 per prescription. And that would be a drug that would be dispensed as written one. Dispensed as written would be that the physician, when they're writing the prescription, would write on it, dispensed as written, and then it gets coded when it goes to the pharmacy, and they change your copay based on that. It does result in some significant costs to our program, which is one of the reasons we're trying to get it managed a little bit better. And so our proposal, which the board adopted, which would be you'd still have the 40% coinsurance, but you would also pay the difference between the generic drug and the drug that was authorized by your provider. And the only way a member could get the cost sharing waived on this kind of prescription would be to have the member's provider write something that's called an FDA MedWatch form, and they would have to return that to Navitas and the FDA Food and Drug Administration. They have a standard form that they use that documents people who can't use dispenses written drugs. So it's up to the provider to take care of that for you, that step for you if you need it. Now I'm going to turn it over to Alex, or Tara, who's going to talk about Alex.
So again, Alex is a tool that we put into place, and right now, anyways, we just rolled this out. We don't have the Medicare programs built into it because there's factors that and different program options. But this is we did build in an option for any pre-Medicare retirees. And so I'm going to just spend a few minutes talking with you all about it. So what it is we call it a virtual benefits counselor, but it's something that's available on our website, and it's an online tool that helps you choose the benefits that are best for you out of all the benefits that are offered through ETF, health-related benefits anyways. So Alex asks you a few questions. He's kind of a cute little animated guy. He asks you a few questions. It's kind of like a fun calculator. So he just asks you questions in plain language. You click on the answers. You don't have to put in any personal information at all. There's no login or password or anything like that. You can easily share it with a spouse or a friend or a family member who might help you pick your benefits. And you can go in and crunch the numbers as many different ways as you want. It's just a tool that you can use over and over with different scenarios to see what benefits might be best for you. Last year, the university actually purchased this product for its active employees. So if anybody retired recently, you might be familiar with it. So the UW rolled this out, like I said, for all of its campuses last year, and ETF was involved in that process, and we really liked the product. The feedback has been really positive, and so what we did is we kind of added on to the contract, and we made this available for all state employees. But then what we also did is we made it, we built in a retiree part to it so that it covers state retirees, pre-Medicare again, and that includes UW retirees. So UW retirees would actually go into the ETF version of ALEX. So you'll see, if you're on any of our websites, the UW's version is this little green guy, and then the ETF version is this little orange guy. And we have a landing page where you can see both of them side by side, and it does say UW retirees use this one, but we just wanted to make that clear. It's the orange guy. And so the benefits that ALEX covers are medical and pharmacy, the opt-out, which doesn't apply to retirees, dental, vision, the Well Wisconsin program. It covers life insurance, accidental death and dismemberment, income continuation insurance, which not all of these apply for retirees. But it knows once you choose that you're a retiree, then it's only going to show you things that you're eligible for. So you wouldn't be eligible anymore for most of the tax savings accounts. But then it also has some really brief information in there about Wisconsin retirement system and EAP and the Life Suite benefits, some other benefits that come with our standard package. So we purchased this and are rolling it out because we constantly hear that there's either, there's too many decisions. We know it's called It's Your Choice, but we really have a lot of options for people. It gets a little overwhelming, so we're trying to just provide yet another way for people to get the information they need. We realize it's not for everyone and that, we still have all the information available in the traditional ways, but this is just an add-on. And again, so it's engaging and interactive, and so if you are pre-Medicare, we would just encourage you to check it out for this year. You're not enrolling in anything. What it does is at the end, it gives you a summary of all the things that that might be the best fit for you, and then you can print that out or just save it and use that when you go into the system to enroll, or if you use paper applications. So it just kind of helps you keep track of everything in one spot. Okay, now I'm going to turn it over to Arlene to talk about Medicare.
Well, good afternoon. Thanks for having us today. It's nice to be back. So today what I wanted to do was start off with some basic information about Medicare, and then we're going to go a little deeper into your current benefits, and then we're also going to be talking about the new Medicare Advantage program. So first off, for those of you who aren't on Medicare yet, you may wonder, okay, when do I apply for Medicare? When you retire, that is when, if you're going to be 65, if you're nearing Medicare, you need to apply then. If you don't get Part B, when you first are eligible for it, later on you can have a penalty. And that penalty from Medicare can be up to 10% per the 12 months where you should have been in B, but you didn't. So it's really important to sign up for Part B, and you automatically get Part A when you sign up for Social Security. If you have an adult disabled dependent on your insurance coverage and you're retired, they should sign up for Medicare as soon as they're eligible for it too. And that would be as per Medicare. If you've got a young dependent who's under age 26, Medicare doesn't apply. If you're retired and you're under age 65, about 3 months before you reach your 65th birthday, ETF will send you this Medicare eligibility statement form. We need you to put in your Medicare information and send that back to us so that we can make sure that we transfer that information to the health plan and have your benefits paid accordingly. I have some along if you need any. Why is it so important that you sign up for Part A and Part B when you're eligible? First off, when you do as a retiree, your medical premiums decrease. They go down pretty significantly. The reason for that is because Medicare pays primary for your claims. And we'll go into the detail about what Medicare covers and how much they cover it in a little bit. If you don't sign up for B, our contract requires that the health plan does not pay for any claims that Part B would have paid if you had had that. We call that the as-if provision. And again, I'll go into the detail about what Medicare pays. So again, it's vitally important that if you're eligible for Part A and B, you have that coverage. Okay. Part A, Medicare 101, take you back to school. Okay, in case you don't already know this, we won't spend much time. Part A is for your facility claims, the hospital, the skilled nursing facility, some home health benefits. You may know that there is an upfront deductible that Part A applies when you go into the hospital, and that's $1,340 right now. And then there's some coinsurance after that. By being in our program with uniform benefits or Medicare Plus, the Medicare supplement, the health plan then picks up that Medicare Part A deductible and any coinsurance so that you don't have to worry about that. The only thing that you would be responsible for would be the $60 emergency room copay when you're on the Medicare plan. Part B. Part B is your professional claims, your doctor claims. Also outpatient therapy, physical, speech, occupational, and durable medical equipment. Again, there is on Part B a $183 deductible right now, and then there's some coinsurance where Medicare picks up 80% of claims, and then the health plan picks up 20%, so that you're not responsible for anything except for durable medical equipment, wheelchairs, hospital beds, crutches, things like that. You do have to pay 20% of those up to a $500 per person max every year. So those are really, outside of drugs, the only medical claims that you would have in a year under this program. Part C, this is new. Although some of you may have had the Medicare Advantage plan with Humana a few years ago. They left our program. So they're back. The Group Insurance Board heard the interest in getting a lower cost quality option, and so they directed ETF staff to go out for a bid, a request for proposal. We did that and evaluated a number of bidders. United Healthcare has won the bid, and we'll be talking more in detail about that. The way a Part C plan works is Medicare hires this vendor, in this case United Healthcare, to pay those Part A and Part B claims. In addition, they're also paying what we call the benefits that are uniform benefits, that Part A and B don't pick up. Those deductibles we talked about. And your medical coverage, but we'll talk about that in a minute. So, excuse me, we're not going to talk about, that's Part D. We'll talk about that in a minute. And so they administer it all. So if you sign up for Medicare Advantage United Healthcare this year, you'll get one ID card. When you go to the doctor, you show them that ID card. You can keep your Medicare Part A and B card in a safe place at home. Hang on to it. And so your claims will get paid faster because the provider will know, oh, okay, this is a Part C plan, this is Medicare Advantage. United Healthcare will process the whole thing and let you know, instead of going to Medicare first and then the health plan. Okay. All right. Part D is your Navitus prescription drug plan. Everybody in our program has Navitus coverage, and we'll go into the benefits a little bit more later. If you need some help with Medicare, we recommend that you call the Medigap helpline. There's the phone number. Or you can call ETF Ombud Services, and they can help you too. Oh, yep. And now I'm going to turn it back over to Tara.
Medicare options. I want to explain the difference between these different options that we've been talking about. Because even though we've had the Medicare Advantage in the past, we do know that everyone hasn't always understood that we've had these three different, we call them plan design options. And so we want to make sure that you understand that. We do find when we look at the data that most people seem to just kind of stick with whichever health plan they had when they were, before they had Medicare. And a lot of people don't seem to understand that they have really a whole new set of options as it relates to ETF plans. And so we don't, at ETF, we don't care which plan you're in. We just want you to have the information so that you can choose the plan that best fits your life. So there's three different, what we call Medicare plan options. And you'll find a chart very similar to this in your decision guide that you'll get in the mail from ETF. So the first one is the It's Your Choice Health Plan Medicare. And that is just the Medicare coordinated version of all the HMO plans that we have. So you'll see if you look over at the administered by column, we have 10 different health plans that administer that same benefit, that same plan. So that's like your Dean and your Quartz and your WEA Trust. All of those different plans that we have that you're probably familiar with as an active employee or pre-Medicare. Then we have the new Medicare Advantage plan, and that one you'll see is only administered by United Healthcare. As Arlene mentioned, they won the procurement process, so they are the sole administrator of that one. And then the It's Your Choice Medicare Plus is another plan that we have available. This one is a Medicare supplement plan, and previously, it was administered by WPS Insurance, and last year it switched over to WEA Trust. So now they are the administrators of this. You can see from the little dollar signs there under the premium column that the pricing is quite different. And if you don't have the guides yet, we do have some up here if you want to look at the premium costs at the break or after this. But you'll see that the lowest dollar symbol there, the black dollar symbols, is in the Medicare Advantage. It is by far the least expensive plan, and it does cover the full gamut of uniform benefits. So same exact benefits. It has a nationwide network, so you can see doctors all across the country, and for a lower cost. The next most expensive plan is the Medicare Plus plan, which is the bottom one. Again, this has not only nationwide coverage, but it also has worldwide coverage. Now, any of our plans would cover you if you were out of the country and you had an emergency, but other than an emergency or very urgent situation, there wouldn't be coverage. The Medicare Plus plan has some coverage, so if there's anybody that's planning to move out of the country, we do have some retirees that live out of the country, this is the plan for them. And the only difference is that this is a supplement plan, and so it doesn't cover the full, what we call uniform benefits, which is what everybody has as an active employee, what everybody has as a pre-Medicare, and that continues once you have Medicare. So that's our full range of benefits. The Medicare supplement is a little different because it only can cover what Medicare covers. So there's no coverage for hearing aids at all, no coverage for like routine hearing and vision exams, or some durable medical equipment. So there are some things that are not covered by this plan. Again, they only cover what Medicare pays. So if Medicare pays part of the claim, like the 80% that Arlene was talking about, then this plan would pay the remaining 20%. But if Medicare doesn't cover it, then this plan wouldn't cover it. So I'm going to spend a few more minutes talking about the nuances comparing these plans. So this next slide is referring to the It's Your Choice Health Plan Medicare, which is, again, that first one that I talked about where there's like 10 different health plans that do that same plan design for us. And we just want people to understand that if you're out of your coverage area, so these are like the regional plans that they choose which counties in Wisconsin they want to provide service in, and a few of them do provide service in areas that border Wisconsin too, like Illinois or Iowa, there's some coverage. But besides being in their smaller service area, they won't cover any out-of-network benefits at all. So if you are out of network, unless it's an emergency, it's not going to be covered. So if you're outside of, you're on vacation, you're in Arizona, or if you go live there for a month out of the year, whatever, if you had a plan such as like Dean or Quartz, they're only going to pay claims if it's an emergency or a true urgent care situation. And they wouldn't cover follow-up care. So you'd have to get in touch with them if, something happened and you needed like physical therapy or something like that after a break or something like that. They would likely have you come back, say you have to come back to the service area for that to be covered. And also we just want to point out that all of our Medicare plans have the same pharmacy coverage through Navitus. So there is nationwide pharmacy coverage across the country. You just have to go to an in-network pharmacy, which is, there's tons of them all over, and I can show anyone how to find that if they need help with that. So how are these plans the same? So again, this It's Your Choice Medicare plan, which is, any of the 10 health plans, or the It's Your Choice Medicare Advantage. So again, I know we keep saying this, but we know this is the main thing that people seem to be confused about. So it's the same exact uniform benefits, and then the cost sharing goes down. Actually, this is not, it doesn't apply to this group, so we're not going to even talk about that. So really, ignore this line about the deductible here, and cross it out if you have a pen. There's no deductible with this plan. So almost all of your services are covered at 100%. And like Arlene was already mentioning, you really only have to pay a $60 emergency room copayment. That goes away if you were admitted into the hospital. But if you go to the ER and then you're sent home that same day, you would pay a $60 copayment. And then the only other cost you're going to have with these plans, besides your drug costs, which is again separate, is 20% for medical equipment and supplies, up to $500 per person per year. For the It's Your Choice Medicare Plus plan, again, that's the WA Trust plan, that's worldwide coverage, and the new It's Your Choice Medicare Advantage. We're just comparing on this one how those are the same. They both have nationwide medical and pharmacy coverage. You can see any doctor who accepts Medicare and will bill the plan. Most healthcare coverage is the same. There's just those few differences. Same prescription drug benefits again. Silver sneakers, they both have silver sneakers, which we know is a popular program. So last year, Medicare Plus did not have silver sneakers, but they've added that in for this year. And Medicare Advantage has silver sneakers. And then they both also cover 120 days in a Medicare-approved skilled nursing facility. So how is Medicare Plus different? And I know I touched on this, but again, this one covers the worldwide coverage. That's why we have the little globe symbol next to it. And then it only covers the medical benefits Medicare covers. So just like I said, the main things that are different are hearing aids. There's no coverage at all for hearing aids. And then routine hearing or vision exams are not covered, and certain medical supplies. So it's just got a smaller list of medical supplies that it covers because it only covers the ones that Medicare covers. Okay, back to Arlene.
All right. So now we're going to go into a little more detail about Medicare Advantage. So first off, the reasons for expanding our options, for adding the Medicare Advantage, we heard you. We had a lot of feedback from retirees saying, we're looking for more options, we're looking for a less expensive option. Some people really like the Medicare Advantage plan because of that nationwide coverage, and because it offers a couple more perks than uniform benefits as permitted by the federal government, and we're going to talk about that. It's very convenient, nationwide coverage. I've been working very closely with the team from Medicare Advantage from UHC with Whitney and another team, and they've been contacting every provider in the state, Dean, GHC South Central, the UW, and saying, working with them, are you in network? Do you understand how you should bill us? Making sure that they're all familiar so that for those of you who enroll, January 1, if you go in and show that United Healthcare card, your provider will know, oh, okay, I'm going to send the claim to UHC, and that will take care of it. And if we've got questions about that, Whitney and Kia can help answer those later on. Okay. Then we also wanted a quality plan. So what Medicare does is they have a star rating program that looks at the plan's quality and their ability to improve member health. This is separate from the report card that ETF does. This is a nationwide review. They compare all Medicare Advantage plans to each other. And the scale goes from 1 star to 5. And UHC has a star rating of 4.5%. So they've been very effective at controlling member cost. One of the good things about that is that Medicare appreciates that and gives them a subsidy to help continue to do that. And that subsidy helps lower your costs while improving your health. And we'll talk about that a little bit more later too. Okay, so United Healthcare submitted a bid. It was evaluated by a team. We recommended to the group insurance board that this be the vendor that was selected for 2019, and the group insurance board approved. It is available only to retirees and their dependents where everyone has Medicare. So right now, unfortunately, if you've got a dependent who isn't eligible for Medicare yet, in 2019 you won't be able to enroll. This is a system problem at ETF that we're working to correct for 2020. Right now, United Healthcare used to be available in our program to non-Medicare people. But they decided they didn't want to do that anymore, so they left the program the beginning of this year. And then they're out of the program for 3 years. That's how our contract works. However, separately, UHC submitted a bid for the Medicare Advantage, submitted a great bid. And so right now, if there was a family plan where one person was on Medicare and one was not, our system at ETF doesn't permit that non-Medicare person to select a different plan, like Dean, like Quartz, like WEA. That is what we're working to fix internally so that for 2020, that will be an additional option for you. It is a lower cost nationwide option. If you haven't seen the rates yet, I think you'll be pleasantly surprised. And some people have been saying, how do they do it? This is too good to be true. So it was a very competitive bid, and they submitted a great bid. That 4.5% CMS star helps bring in extra funding. They were very interested in the business. So originally in February, they gave us a rate for the Medicare program that was already lower than everybody else for the medical portion. Then Medicare annually does this review where they look at the star ratings and how the members' health has improved. And then they say, okay, health plan, for 2019, this is your rate. This is what, we're going to pay you. It was lower than what they had bid to us in February. So the rates have come down since then. Okay, so then the next question is how long is this going to last? Okay, so when they bid us that first rate in February, they guaranteed that that rate was not going to change for 2020. And then they said, okay, for 2021, it might go up a little, it might go down, based upon how the plan progresses. So remember that February rate was already lower than everybody else's rate. So it's looking very good for 2020 that this will continue to be the low-cost plan, and the rates will be very favorable. Okay. You may have come to some of United Healthcare's 90-plus sessions across the state. They started up in July and kept going all the way through August. Now they're going to attend benefit fairs. So if you go to UW-Madison or one of the other UWs for the health fair, they'll be there. And then there also is materials on their website, such as an e-learning, that you may find very helpful. Some of the perks that Medicare Advantage can offer you that the other plans can't or don't. They have a very innovative program called House Calls, which I think is really neat. You, as a member of UHC, can call them and invite a nurse practitioner into your home who can help you with coordinating your primary care visits with your specialist. Make sure, sometimes we have got too many rugs on the floor and we tend to trip. And the nurse practitioner is like, oh, okay, maybe we should adjust this. It's a wonderful program, and it's completely voluntary. You contact them to say, I'd like them to come. They'll tell you who's coming, when they're coming, what car they drive. So it's very safe. Another thing that they offer is virtual visits, like telehealth that all the plans are offering. They have some enhanced preventive care services. They offer some additional podiatry services to take care of nail trimming, removals of corns and calluses, things like that, for up to 6 visits a year in addition, because some people have trouble reaching their feet. I know my mother-in-law has issues with it. Then, on the wellness side, as Tara said, they offer silver sneakers. They offer a benefit for hearing aids, high-end hearing aids, where you can get a very good discount so that your normal hearing aid benefit, where you pay 20% coinsurance up to that $1,000 plan paid maximum per year, every 3 years, you can get a very high-end hearing aid using that benefit. Remember, it's every 3 years, so if you got a hearing aid last year, you need to wait a couple. And then finally, Renew Rewards. If you do certain preventive health screening, you can get financial incentives, gift cards. So that's a nice incentive. Okay, now I'd like to talk briefly about give you a refresher on your pharmacy benefits. Very little change this year. Doesn't really apply to the Medicare folks, but we wanted to just mention it so that it was fresh in your mind. If you go and get level 1 drugs, which are most generics and a few preferred brand name drugs, you have a $5 copayment every time you go, and that counts up to a maximum out-of-pocket of $600 per individual and $1,200 per family for the year. If you hit that max in level 1 and level 2, then it's covered at 100% for the rest of the year. Level 2 drugs are many preferred brand name drugs and a few higher cost preferred generic. And what do you mean by a preferred drug? Those are more cost-effective drugs than other drugs on the formulary. So that's the difference. They're more cost-effective. And again, any co-payments you make towards that level 2 drug, where you pay 20% up to a $50 max per script, that accumulates to that $600 individual, $1,200 family out-of-pocket max. Some people use level 3 drugs. Those are not preferred drugs, and they have lower cost alternatives that are level 1 or level 2. However, if you want to continue to use your level 3 drugs, you may. However, you will pay 40% of that, up to $150 max per script, as the drug is medically necessary, and it accumulates to the federal out-of-pocket maximum, which is much higher, $6,850 per year, and for single, and $13,700 per family. some people need specialty drugs. Specialty drugs are outpatient drugs to treat a very serious illness like cancer, rheumatoid arthritis, MS, things like that. If you go to fill these at 2 pharmacies, either Lumicera, which is a mail order, or the UW Specialty Pharmacy here in Madison, they also do mail order, then you'll have a $50 copayment on your specialty drug. It accumulates to that lower out-of-pocket. If you're a non-Medicare person, that's the only way you get the specialty drugs, by going to Lumicera or the UW Specialty Pharmacy. However, if you're in Medicare, you've got more options. Then you can fill it at other pharmacies. However, you'll pay 40% to a $200 maximum. Okay, all right. So that's the highlights on that. Okay, now I'm going to turn it back over to Tara.
Okay. I am just going to show you where some more resources are so you can find additional information if you would like to find it. So the first thing is, this is just a picture of what the ETF website looks like if you go to it. So this is the etf.wi.gov website. And right on the top left, you'll see there's a member education option. And if you click there, you'll get to a screen, and you have to kind of scroll down to this retired section. So there's a section that's for new employee, nearing retirement. It kind of goes down the line. And so if you go to the retired section, we have a bunch of little videos and e-learning that we developed to help with your benefits. So we have one that we showed this group last year. It's actually 5 short little videos about your health benefits in retirement. So it has how to pay for your health benefits in retirement, and what about supplemental benefits in retirement, and accessing your benefits when you're out of state in retirement, and that kind of thing. So it's a lot of the information you can find by reading, but the videos are kind of more fun. And you can also watch them on, a tablet or a smartphone or something if you if you do that. And then we also have a video on how to choose your health benefits. And then we have the It's Your Choice, Important Changes. We just loaded the 2019 version of it. So that is out on our website now. And then we also have a handy video on pharmacy benefits and tips for saving on your pharmacy benefits. I think there's 5 tips there for saving on prescription drug costs that's worth watching, and that's about a 5-minute video. And then all the videos have they have links underneath to resource sheets that are just nice handouts that are provide the information kind of in a summary format of what was in the video, so you can have that for reference. And we try to break down on those kind of just what are the key things you need to know, and then what any things you need to take action on. So I wanted you to know that those are out there. We also, as a part of that health benefits in retirement, we have a new to Medicare video out there, which we've gotten really great feedback on, because it's kind of, there's kind of a lot to think about as you're aging, turning 65 and new to Medicare. And then, like I mentioned, one is on accessing your health benefits while out of state. And then you can also, and you'll find this little red envelope all over our website, but if you don't already subscribe, you can click on that and you can sign up to receive ETF email updates. So every time there's, you can sign up just for health benefit categories, or you can sign up for WRS categories or whatever you're interested in. But then ETF will send you emails when there's something that happens. So a lot of times if we have news or something's changing, we'll send out messages this way, and it's just a good way to stay informed of what's going on with your benefits.
Okay.
And that is it.
So now we've been at this for about an hour, and we were thinking that it would be a good time to take a break. We'd like to limit that break to 10 minutes, because then we'll have more time for questions, because we're here till 4. Okay, thanks.